On behalf of the team at the Forum for Healthcare Strategists, Judy, Debbie, Jen, Krista, and me, Daniel Nyman, as well as our partners at Brand Active, welcome and thank you for joining us for today's webinar. Over the past 3 months, we've been focused on providing you with real-time information from your expert friends and colleagues across the country. For the program today, we've turned to some of the best and brightest to talk about what they're seeing, hearing, and experiencing to offer advice and insights for returning healthcare organizations to growth in the post-COVID world. Looking ahead, the Forum is excited to announce its first virtual healthcare marketing and physician strategy summit. It will be held August 18th to the 20th and will feature many of the content-rich sessions from the original summit, plus new sessions to help you navigate beyond the pandemic. Watch for details coming soon. A final note before we begin. Attendees are participating in listen-only mode, but you can still ask questions. Simply type your questions into the question and answer pane located on the bottom of your screen at any time. At the end of the presentation, our panelists will answer as many questions as time allows. With that, I'll turn the program over to Philip Giuliano, a partner at Brand Active, who will be moderating today's discussion. Philip?
Great. Thank you, Daniel. Very pleased to be here with everybody and share this forum. As Daniel said, I'm Philip Giuliano, and for those that don't know me, I spent the majority of my early career as an M&A and org change consultant. And I'm now 14 years into my journey here at Brand Active, where we don't do brand strategy and creative, as the name might indicate, but rather we focus on the financial analysis and the logistics of brand implementation and marketing operations, which really just means that we save health systems a lot of money and improve efficiencies and the outcomes of large brand initiatives, or just how they operate managing the brand that they already have on a day-to-day basis. And so that's why this kind of a topic, particularly how you operate during a crisis and how you set yourself up to emerge from a crisis, was a really interesting thing for us to put together a panel around. So I know that I speak for everyone when I say that we appreciate you all choosing to spend your time with us today. And with the group that we have gathered here, I'm pretty sure you're going to come away with some interesting insights and ideas. And as David mentioned, we will have a Q&A, about 15 to 20 minutes or so of that at the end of the session. You can submit your questions. I'll get to them. We also have a couple of poll questions in here as well. So with that, joining me today, we've got a really great panel of people. We've got Kevin Mabbitt, SVP and Chief Consumer Officer at Intermountain Healthcare. We've got David Perry, a Senior Advisor at Stanford Medicine, Suzanne Sawyer, Senior Vice President and Chief Marketing and Communications Officer at Johns Hopkins Medicine, and Gene Hitchcock, President of Hitchcock Marketing Communications. So together through this session, we're going to be looking at how healthcare leaders are rising to the challenges of COVID, leading their organizations as they redefine everything from activities and priorities and operations and communications needs in the face of what we all know is a very dynamic patient need environment right now, as well as a very dynamic business landscape, in order to drive reputation and obviously ultimately revenue. So to begin, we've got some interesting data points from Binary Fountain that I think serve as an interesting warm-up as we move into the session. So they surveyed over 300 healthcare marketers to determine how the crisis has changed their daily routine and marketing priorities. And when you look at this, there's some things that changed quite a bit and a lot of things that didn't change a lot. But obviously you look at it and you say, okay, emphasis on crisis communications and social channels was stronger during COVID. Not surprising. And also not surprising, based on just traditionally how healthcare marketing organizations respond or how healthcare organizations in general respond, albeit not always the most prudent thing to do, is how the emphasis on branding went down during this time. The panelists will get into this as we get into the conversation. Obviously, this is an aggregate view, and not all health systems responded in the same ways, and not all of these health systems responded in the same ways. Another little final warm-up slide here is looking at what channels were used to actually do those communications efforts that we talked about on the previous slide. And it's interesting, even as we're talking with clients of ours, the emphasis on phone calls, email marketing, text messages, those kinds of things, that's expected during a time like this. And some of the clients that we work with are even ramping up things that they're doing with physical mail efforts and things of that nature. So we're going to get again into how these organizations on this panel have been dealing with the communications challenges during this time. So With that, I think it would be great to jump into a poll for the audience, just to sort of see where everyone's barometer is. And the question that we've got right now is, what will be the most impactful and long-lasting change element for marketing departments and health systems following COVID-19? Got a few canned answers in there. We've also given you the opportunity to write in your own. Obviously, if the canned answers fit what you want to say, then do that, because it'll give us some better results. But otherwise, if you want to throw something in there, then by all means, go for it. Just going to give this a little bit of time as everyone responds to things. I know we put a few answers on there. Everything from M&A to doom and gloom, bankruptcies and closures, dealing with layoffs and restructuring, increased importance of marketing departments. This is a really interesting one that we're going to talk about. Let's give this maybe, and there it is. All right. So just looking at this, I wonder if I'm actually able to interact with this here. And I am. So generally, wow, that is great. Actually, increased strategic importance of marketing within the organization. We're seeing that across all of our clients, honestly. This has presented a really interesting time for people to deal across, whether it's IT or finance or operations. That's really great. Agile mindsets, fewer financial resources. Yeah. Hopefully that won't be the case when we think about things in a long-lasting way, particularly with increased strategic importance of marketing within the organization. If that can be leveraged properly, then hopefully that frees up financial resources. So that's really great. Thanks for taking the time to actually answer that. I think it just sort of lets us all see where we're all thinking as we move into this. So let's start in and dive into the panel discussion. We're going to start off on the brand direction. I'll just kind of remind the panel as we get into this, as I'm going to direct questions individually at you, particularly here at the start, and just play off each other as we get into it. Don't be afraid to do that, even though I'm asking a question directly. So let's start with you, Suzanne. First and foremost, thank you. Thank you to Hopkins for the role that it's played during this crisis as well. And it goes without saying that the value that Hopkins has brought to the nation with the resource center that you've created. And I'm just curious, as we start off on the brand side of things, how has this helped your brand?
Wow. Well, I think by now, most folks probably are familiar with what you're talking about, the Johns Hopkins Coronavirus Resource Center. It features the COVID-19 map and tracker that I think we all know well at this point. But it also includes other content from across Hopkins, the School of Public Health, Engineering, Medicine, the Center for Health Security, and Johns Hopkins Medicine, the health system itself. So I would say that while many of us know it, especially for tracking the COVID cases themselves, the additional content, the full range of information that was cited again and again, this really became sort of a one Hopkins kind of moment from a substantive point of view, but also from a brand point of view. And I would say that as a result, I think the Hopkins brand has never been stronger. And we've also just recently received some new market research that shows that Hopkins is now showing as #1 as America's top research university. Mm-hmm. And so the impact on the Johns Hopkins Medicine brand itself, meaning the hospitals and health system, is seeing significant reputation growth and momentum.
I mean, I'm curious, this is not a small effort to create and to populate and to manage. Is there anything that you can share with the group as a whole around, what it took for the organization to dive right in and make this happen so quickly?
Oh, it's a really interesting story. Thanks for asking. It's, on a weekend in the end of February, our president, Ron Daniels, president of the university, said, I see a lot of content starting to emerge about coronavirus. And he said, we've got a lot of content across our websites. What if we, brought it all together along with this map that our engineering group put together, and said, let's put this together, something across the university that all of our schools can contribute to. And let's do it. I think it was on a Sunday afternoon. And he said, let's have it up by Tuesday. And we did. And it was an incredibly remarkable lift, but it just grew from there, and it just sort of took off.
That's awesome. Thanks for sharing. I was just curious.
Yep.
David, what about at Stanford Medicine? I know that you've also launched video series and other educational elements, and I'm curious what you're seeing with the brand overall.
We had a discussion internally about we were about ready to evolve our brand a bit at the time that COVID hit, and what we realized is how you behave, how you operate within a crisis like COVID really defines your brand. So the perception of it, I think, locally, regionally, and nationally. Hats off to Suzanne and the team at Johns Hopkins for their broad effort around the map, and we look at that as well as a healthcare system. For us, we zeroed in on a couple of things. We had a physician interested in doing a digital tracker, so a form of content. So he is tracking day to day thousands and thousands of folks that are responding to a daily survey. That was something we needed to jump in and support and embrace. And we sort of adopted what we called the 4 E's around our patients and our referring physicians, our audiences, and that's engage, educate, encourage, and enable. So everything we did, first and foremost, was to educate. Our priority was safety, and we built some videos around that and are continuing to do that. I think those will probably go on beyond COVID because we started to understand how powerful that type of medium can be for all types of topics. And it just turns out we have created around 10 to 12 themes, and we're in the midst of, I think, the third or fourth one. But I hope that, like I think a lot of the panelists will tell you, I hope a lot of the things we've adopted, whether it's a virtual video series, some of this outreach we're doing, the map that Suzanne's team's doing, I hope there are remnants of that or legacy of that, some of the agility that you get from this effort. You kind of a change in mindset will retain. So I see a lot of the content we're generating being something that we just continue to work on, develop a really rich content calendar. I think that's one of the outcomes you'll see from that for our brand at Stanford Medicine.
And Gene, that we do a lot of work inside of healthcare, obviously, biggest practice, but we do a lot outside of healthcare. And as I think about, times of downturn, whether it's, oil, gas, and energy, or whether it's, financials in 2008, times like this really, present a lot of opportunity for people around brand, either during the time to, build goodwill, because you are basically, the major focus of, a pandemic element, right? Or also to really position themselves to catapult once things start freeing up and things start opening back up. From a brand perspective, and really say something new and different to the community. And I know you've got a unique perspective because you work across multiple systems and advisory roles. Is there anything that you want to say about sort of what you would be doing or what you're advising people to be doing with brand during this time?
Well, I think a lot of people, their branding really was more around public relations and taking more of a public affairs sort of role with their community. Also, my hat's off to Suzanne and Johns Hopkins. They've done a wonderful job. But it is an opportunity for the marketing department to look at its own brand in the sense that they are uniquely positioned to drive business to their organizations, and that they have an exterior input from the market and they have a knowledge of the marketing of the market and how to market to it. So this is a time, I think, for marketing to step forward and partner with finance and operations to drive business. And I do think that we are enjoying, and I say the collective we, as someone who's been in healthcare a long time, of much higher respect and recognition by our communities. The outpouring of support to heroes has been amazing. And then the white coats supporting the Black Matters, it's just becoming sort of a groundswell that we haven't enjoyed all the time. Healthcare hasn't been, we lost a little bit of our luster of not being the community resource. I think we're getting a lot of that back, and it's just been so heartwarming to see that.
Hmm. Yeah, I mean, that kind of shifts us into, that's great, thank you. It kind of shifts us into sort of the organizational perception element of this talk. So why don't we jump into there, because you mentioned it. So I'm curious, Kevin, you know, how has this at Intermountain, the COVID situation, you know, the pressures, the stresses, the shifts in technology and so on, how has that put marketing more on the map within your system across operations, finance, other operational areas, things like that? Oh, we may not actually have sound for Kevin.
Uh-oh.
Ah, all right. Well, I'm going to direct that back to you, Suzanne. Can you share anything about how those perceptions have been shifting within marketing, and any opportunities that you might actually see to, again, sort of elevate marketing's perception within the organization and your ability to get things done?
Yeah, sure. I think I would echo Jean's comments. I think this really is a time of, in some ways, resurgence, and in some ways, a new appreciation of what marketing can and should do. I think marketing just brings so much to the table. I think much more than is often understood, I would say, inside of our organizations. You know, marketing is a strategic business function, right? And I think that's more important now, perhaps, than ever, especially when healthcare is going through structural change and reinvention in the wake of COVID. I mean, I think part of what we bring is a really deep understanding of the patients, the families, and the communities that we serve. I think we have a role, excuse me, in shaping our culture internally, as well as our external view, our reputation, and how to express our brands really in a human way. And I guess the other big thing I would add is that I think, you know, marketing is now also a technology business in so many ways. And so with that, we've got both the ability and the accountability to drive measurable growth. So these are just some of the things where I think marketing makes a big difference now more than ever.
Yeah. David, you've mentioned your investments into MarTech and the organizational's appetite for these kinds of things, even during a time of lower investment and shifting priorities towards that. Can you share anything with the group on that?
Well, what you realize in a crisis like COVID-19 is for us, we don't have everything built out that we would like. For instance, a digital asset management tool would have been great for all this content. To make it a lot easier to access, repurpose, et cetera. So I think more than anything, it was a lesson learned, not only for marketing, who has to ask for money, obviously, from finance and our best friends at work, finance and operations, but I think the rest of the organization just realized how important those tools are and how they'll become more important. And the good news is this comes at a time where those tools are probably more accessible, more deployable than they've ever been with cloud-based computing. So that's been a really kind of a good turn of events for us. I'd say lemons to lemonade in our case, and I think we'll be able to invest even further in those. The other thing I'd say to add on to Suzanne, she made some great points. We are really called upon to bring kind of the research and insights, because there's a lot of anecdotal evidence within a hospital where people are going every day and you're locked down, you know, particularly during the height of COVID. We did not experience the surge that some others did, particularly in New York. But people within the organization had a view of, well, this is what patients feel. This is what referring physicians feel. We actually knew because we had generated research around that and taken third-party research and extrapolated it. And we were able to kind of calm a little bit and say, this is what people need to know now. Now, frankly, it varies between, say, San Mateo County and Santa Clara County. Right. Policies for each county. It is Northern California, after all. We're pretty serious about these things. So I think we added a lot of value on that front as well. Not only, you know, the technology, but just some of the insights that we could bring forward to add value to discussions internally about who, what, when we're able to communicate and what we're able to say, and how we'll calm the fears of our community, our patients, and our referring physicians.
Yeah. So I'm gonna jump us ahead here a little bit in the conversation because, some questions are coming in around telehealth and, we're talking about technology now. So I think we might as well just jump right into that real quick, Jean.
Okay.
Sort of the day in the sun has arrived, right? And everyone has scrambled to figure out how to make something, that was on everyone's radar for years and years happen in, weeks and weeks. So
Right. Just story after story that we've all heard of people around the United States who got their telehealth program up overnight. They've been talking about it forever.
Right.
So, necessity was the mother of invention. I also think the same sort of urgency is something we need with the rest of the MarTech. If you're in the middle of looking at CRM and you're making the case, boy, you really have an opportunity now to make that case. You can really show how you can bring the right kind of business to your organization, that you can fill physician practices. So in some ways, it's an opportunity for marketers to leverage that because we have these tools, as Dave said, like we've never had before, and we can really demonstrate what we bring to the table. So while a lot of vendor selections that I was involved in were put on hold around the end of February, they're all starting to gear up again because they're saying to their CEOs, I can help you meet your bottom line. I can do this. And to Suzanne's point, if we weren't in healthcare, that's what they would expect marketing to do.
Right.
So our day has come, I think. I'm very excited about people I work with who are seeing this as an opportunity and not as, oh my God, what are we going to do? Because look at telehealth as the way we moved. We can move when we have to. And I think telehealth is the rallying call.
Anyone else on the panel want to share anything about telehealth or tech before we shift gears here real quick?
Yeah, if I may, this is Suzanne again. Exactly what you just said, Jean. A week and a half ago, I took my proposal to invest in a CRM and as well as claims data for PRM activity and some other things, and had great support going in and had the good fortune to have an approval come through.
Mm-hmm.
So this is something that, I think Hopkins and many other organizations have wanted for quite some time, to be able to do exactly what you said, which is to help build the right business in a way that's efficient. And so, it is our time to be able to contribute in this meaningful way. I agree.
So
I would add to that as well. I think you learn a lot of things in a crisis like this, and our telehealth encounters shot up in a couple areas that I didn't really anticipate. I'm the father of a special needs son, and so when you look into kind of mental health, behavioral health, a lot of those patients probably would prefer the telehealth services, right?
Right.
Don't want to go into large facilities and encounter people. And so I think that might be a benefit to some of our population health efforts, some of those service lines that may not be our tier one investments, where we are be able to cast maybe a wider net and provide even more services cost effectively, because it looks like the payers have joined in and are supporting telehealth. That was a key obstacle to overcome. So there's another great lemons to lemonade story, I think, here from the standpoint of reimbursement and new areas of service. So I'm pretty excited about this. I think it's going to be a very positive long-term effect for the healthcare industry and for marketing, where we can actually support it and bring it to the fore.
I want to keep the optimistic energy going and the positivity going, and yet I want to ask a question about money, because this is one of those forums where we've got a lot of people online. They don't necessarily always have visibility into what's happening with so many organizations, or powerful organizations like yours, from a marketing budget standpoint. So very quick dialogue around: are your budgets shrinking? Are they staying the same? Focus is shifting. Suzanne, why don't we start with you?
Sure. Budgets are tight, right? For all of healthcare right now, for hospitals, health systems, provider groups. That being said, again, I would just say the kinds of things that we are able to do with thoughtful kinds of investments, like these platform kinds of technologies, at least at Hopkins are getting a hearing, which is really good. There's also openness to the other items on our strategic roadmap, where we are able to better connect and engage with patients, referring providers, and so on. We'll see what's around the corner. But at the moment, there is real openness for the conversation where they maybe had heard about these things, but not necessarily understood them.
Right.
Now they're necessary. So we're getting a good audience for it.
All right. So I've got a communications question, one final communications question, and then we'll jump into another poll question. So with little national direction and different policies that exist from state to state, from county to county, from city to city, especially in systems like yours that have such good span of attention, how are you engaging with and communicating to the public to let them know what is available, what's open? How are you going to re-engage them, prepare to re-engage them back into the health system and drive them towards, the things that are, necessary services for them on a health basis and also profitable for the health system? Jean, do you want to jump in on that one first?
Well, let me take the role of the patient, and I'll let my colleagues here be the provider side. Where I live is there's 4 contiguous states and Washington, D.C., and I have used a number of health systems. I have received a number of communications from the different health systems I'm a patient of. The most effective have been when my personal physician's office, doesn't have to be the doctor, but if the office calls or someone is there to answer my questions, because the chief medical officer sending a letter to every patient who has ever seen one of the doctors or one of the physicians in the medical group, it doesn't hit, because patients want to know stuff like, do I sit in my car till it's time? And those letters tend to be at 50,000 feet. So from a patient's perspective, I've appreciated the personalized emails or the ability to call my doctor's offices and that they're informed. So for me, that's been very, very beneficial. And I also have shared with this group the other day that the Cleveland Clinic, who's a huge system, has done a wonderful job with their portal. And that would be something I would encourage people to take a look at. I'll turn it over to the others to be providers.
Suzanne, do you want to jump in on that?
Yeah, sure. First, I would just say, honestly, the predecessor to answering the question was, what is our process for bringing care back? And I would just say that at Hopkins, it was a very deliberate process to really define our clinical approach and methods, and to returning to care, into developing a prioritization kind of schema to manage a backlog of more than 10,000 cases.
Wow.
And so, the communications effort then became very important to be very intentional. What is going to happen on the outpatient basis? What about ambulatory surgery? Urgent, but not emergent cases. And so we did take a very purposeful approach of the kind of very personalized outreach, especially for those complex cases or urgent cases, those first. So we had a really tightly orchestrated approach. But we had surgeons calling patients as well as patient service reps calling patients. It sort of depended. But the outreach was very important, and the engagement was really interesting. I mean, the feedback that patients had was remarkable. I think many of us have seen the market research that showed, at least early on, and it's tapering off, that people are extremely anxious about returning for care, especially within the first 3 months. And so being able to reassure about that kind of detail that you were talking about, Jean, what exactly am I going to encounter? What is my experience going to be like? How are you cleaning the surfaces? How are you going to tell my husband that my, procedure is over and he can come and collect me now? And so all of those things really help to inform how we approached getting back to business, so to speak, and engaging with our patients first and foremost.
Mm-hmm. Kevin, I believe that you're back with us now, and I would love to direct a question back at you before we go to the poll. So, just thinking back to what we've covered so far, I'd love to ask you what you see as the biggest challenges that you still have ahead of you, and also the biggest opportunities that you see in the time that you spent over the last 10 weeks or so during all of the COVID fallout and recovery, hopefully. Oh,
thank you, Philip. Firstly, can I check you can hear me?
There you are. No, I don't think we've actually got you, Kevin. Very quiet. Okay.
Can you hear me, Philip?
I can now, yes.
You can hear me now?
I can. You may want to turn off your video real quick, just to be safe, and see if the voice comes through.
Yeah. Just let me know you can hear me now, Philip, if you wouldn't mind.
Yes, I can hear you. Do you want me to ask that question again?
You hear me, Philip? Okay. So sorry. No, I'm good. I just did not want to be the one you hear me. No, I'm good. I just want to be the one that started.
Yeah, I think we're going to have to shift gears to a poll question when we get the technology figured out, Kevin.
No, I think
it's a bit too so. Yeah, why don't we jump into this poll question real quick, and we'll come back to that. So, coming out of focus, if coming out of COVID, if you could focus your healthcare organization on one of the marketing related items below, what would it be? So a little more consolidated list here, but is this a time to reposition or rebrand? Is this a time to clean up architecture potentially, to look at how to operate more efficiently, implement more technology, hire additional staff potentially? That would be nice. Outsource more common, invest more in advertising, or make your own answer on that. So we'll give this just a bit of time here. Again, I think it just gives all of us an idea of where everyone's mindset is at, and then we can shift into another area around operational efficiency potentially here. We'll give this another 10 seconds maybe, and then jump in. I'm very curious to see what everyone puts together. I was going to ask our panelists to come up with songs that they could play during the polling questions, but decided that might not necessarily go so well depending on the music taste of everybody. So, okay, operate more efficiently is numero uno. Implement more technology is not surprising. I actually thought that might be numero uno. And then opportunity to reposition or rebrand. I am surprised actually to see that one as high as it is. I couldn't agree more, even though I don't do branding, but I mean, this is one of those times where so much of the perception and the value equation around what health systems represent to the public, and by the way, also the opportunity to take advantage of what's going to happen on the other side of this. Mm-hmm. So all good things. The operate more efficiently as a marketing department element. I'm very interested in this, and I think we'll jump into a panel discussion around this as well. We find that these kinds of situations, I mean, marketing departments in general are, always pressured to do more for less. And, they're also the first things to get defunded when, business downturns. So the best way for marketing to help themselves get more dollars, whatever that might look like, is to find the money, right? And you can find the money in areas within marketing around processes and technology and tools and, automation and business process management, analytics, that kind of stuff. And you can also find money outside of marketing, as you look at how brand related spend is being spent in ways that marketing doesn't control. Right. So you've got, facilities that are being implemented and signage and wayfinding environments and experience and all of that going in on a daily basis. You've got, HR materials and employer brand and training and things of that nature that are all brand related that people are investing money in. Right. So, looking across operational areas, that represents a really good opportunity to find a ton of money. Again, thinking about the areas of people, processes, technology, tools, agencies, vendors, renegotiations, that kind of stuff. So, is a big area of interest for me. So I can go on that for a long time, but I'm more interested in what the panel has to say around what you're looking at right now to potentially drive those operational efficiencies or just change the way marketing is operating to find some of that money. Again, Suzanne, why don't we start with you?
Sure. You're right. There's a lot of areas where we partner or should, and there are a lot of line items, so to speak, that may not be in the marketing budget, but have a marketing impact. I would just say that maybe again, speaking about my own situation, I partner very closely with finance and operations, as part of your question suggests. And in fact, my boss is the CFO and the Chief Operating Officer of Johns Hopkins Medicine. So first of all, the organization recognizes the importance of this alignment, but it has also been tremendous, at least in my situation, that our CFO and COO in one really understands our strategy and has been a real advocate for the kinds of investments that you're talking about. Again, because working with that, those parts of the organization, it's been very helpful for me, especially as a relative newcomer to Hopkins, to be able to have people sort of say, okay, what you're talking about sits over here, or it's over here. Let's facilitate a conversation. So I agree with your point about finance and operations quite a bit. I would also say, though, that I have a couple of other key partners. And one of them is the Chief Information Officer and that team, especially around the digital front door and the patient experience, as well as marketing technology, but really being able to think together in a way that's a thoughtful strategy between our groups. So I'm very happy about how that relationship is strong, was strong certainly before my arrival, but it's something that I've really invested in. And another key partner is our Chief Human Resources Officer.
Right.
And that person and that relationship and her team and my team work together on many things, not the least of which includes internal communications and building our culture. But it also is around the communications that are around things like furloughs or other workforce planning activity in each of our different entities, and the conversations that happen around them. So anyway, just to underscore the point, I think the CHRO is another really important partner.
Yeah. Gene or David, anything you want to add on that around, where you're looking for efficiencies, how you're looking at all of that?
Well, I would add to Suzanne's list the foundation or philanthropy, and the recruitment function of HR is a biggie. And then the other one that is very large in a lot of people's lives is the medical group management. Who manages the medical group, and really working with them to have an understanding about the marketing. When I saw the question, I would have added efficiently and effectively. And that goes to the reason why you have these relationships with these folks, because you can really show them how effective you can be in driving business to the organization. So building those relationships are key, and then demonstrating value, I think, is key. And a lot of people are looking at what can we do. And when you have partners like that, it's not a single conversation with yourself. You're having other people saying, maybe there's a way we can work together on this or something. Let's talk about that. Because reputation management is as important to marketing as it is to philanthropy and recruitment.
Totally.
And so common goals can drive some common solutions.
Yeah, I think if you look at, we were talking about tools earlier, we've identified our best friends at work. I guess that's an HR term, but we're making a sort of a joint presentation to finance about the use of CRM tools and marketing automation with the physician liaisons who had a pretty tough job the past 3 months, reaching out to those medical groups saying, please bring your patients back. And in fact, that was our first step, because oftentimes, as Jean's example shows, as you talk to your primary care physician, your internist, whoever you trust, and say, can I go back to Stanford? Yes, they've contacted me. I feel very confident that you go back. So we're looking at tools that will make that job more efficient and how we could work more closely together. I would say patient experience too. We work very closely with them. We have a superb VP of patient experience who really is studying that and the tools that it's going to take to improve that further. And sometimes that's within marketing, sometimes it's not, sometimes the call center is. In our case, we have to really collaborate very closely, bring IT into the mix and try to look at that whole journey. And again, another opportunity, I think coming out of COVID, there's going to be more interest in that. Marketing is going to be brought to the table. I think we prove ourselves in that area. So I see, again, a lot of great legacy effects to working with these best friends at work in a more collaborative way than we ever have before. And I think those tools will be a key part of it. And working together, we can present to finance and show the benefit not only to marketing, but greater referral, number of different areas that touches corporate partners, foundation, that sort of thing.
Yeah. So I want to make sure we have time for Q&A. And there's a lot of other things that I think we can get into, even just through the discussions that we had prior to this. But one of the questions that's come up, a couple of times here as I look at the Q&A screen is around advice for smaller, more rural health systems. Particularly right now as we start seeing COVID cases rising in rural communities and growth, over the nearest term. So they don't have the same level of finances and resources. So what advice would you have for them?
I can jump in quickly. I'm sitting in Montana right now, over very rural. When I was at the University of Utah Health, we had a network of partners throughout rural Idaho and Utah, Wyoming, et cetera. And I think you can, call on your partners too. If you have a partner that generates a lot of content like an AMC, that's what we would do for our regional partners. That's something to think about. I think using the communications channel, which obviously isn't as costly as paid media, to really reach out to whatever media channels in the area. Most rural areas have some radio, print, social media, and really step out as a key purveyor of great information, right? Of really timely information that, again, goes back to those 4 E's I talked about: educates and engages. And I also think in a smaller area, you have this channel to referring physicians. There aren't as many of them. You can probably make a more personal type of outreach to them, and they can also, convey your message as well as an extended channel for a regional or a small rural hospital.
I would agree with, I'll just comment on that last point that you just made, Dave. Reaching out to referring providers in the rural markets with your own faculty or, medical staff, I think is really important, whether it's through liaisons or direct doc to doc. And, one example is tonight we are having a webcast, a rather large gathering of some of our providers from Hopkins with our referring providers, really, again, wanting to understand more about the back to care and what they need to know and what resources we have perhaps that can support their practices with information, with referral information and access information and more. So I think it's also part of our charter, right? We need to be doing that and be a resource to the patients as well as to the referring providers.
Philip, if I could just add to that, I have a client in South Carolina, rural,
Yeah.
been sort of an adjunct member of the team during COVID because they have so few hands. But there's also a benefit to being a small healthcare provider. It's easier to communicate. Everyone knows everyone. The CEO of this hospital started, doing virtual breakfasts with the chief of police, the realtor association, people like that. You can actually get to your people faster than if you're a very large system. Now, having said that, I think people like Hopkins and Stanford and Intermountain are wonderful about sharing what they have, the Cleveland Clinic portal, et cetera, that, there's no shame in taking other people's content and saying, this is what and then making it your own, saying, this is what they're doing here, but this is what we're doing in our neighborhood type of thing. So it is a challenge because they usually have very small staffs, but the other thing is they're probably closer to their constituents than a lot of us that have worked in, $8 million, health systems. So there's a plus and a minus to rural marketing teams.
Mm-hmm. Question, actually a very specific question. So what are your go-to research sources when it comes to consumer preference and trends throughout COVID-19? Are there things that you've found beneficial? Anything you would tell people to say, well, certainly if you want to understand consumer preference and trends, you should definitely be looking at these two things?
Are you looking at what are consumers looking for from providers?
I think that's the nature of the question. Yes. Yeah. It's a question asked on the forum here, and that's how I would interpret it is, as far as it relates to, what consumers are looking to you to provide.
We look at a couple of sources. We do our own primary research, but not as much as we would like, particularly for our own region. But I have used some interesting surveys that a couple of organizations, Revive Health is doing some research that they're sharing. I believe we are a client of a researcher, Robert Klein, who does a lot of great research around COVID. Right. And I think sharing some of that. I don't know if it's all shared. Jean may have a better idea, but that's been very useful to us. So we have cited both those sources, and obviously we keep close watch on what Hopkins Tracker is doing in their site as far as cases and metrics like that. But those are two good sources that we've relied upon.
I would agree completely with you, Dave. We access those same resources, Revive Health and Rob Klein's survey. And we also have a virtual advisors, kind of program of our own where we query and ask our own patients that have agreed to be part of panels for their feedback. And we do it relatively frequently on a wide variety of different kinds of topics. And so we have the benefit then of maybe a broader national view, and then we're able to bring it a little bit closer to home or specific to tie into, our own patients and how they're thinking and feeling. Mm-hmm. That's very helpful too.
I think too, locally is important because Northern California might be much different than Montana or Philadelphia or Baltimore. And, municipalities, this is so unique. We've talked about this. States are different, municipalities are different. And I think that really impacts perception, right? If you're in a place that's very strict, it's going to change your behavior and view than one that's not. So I think in this case, we found local research when we could get it, when we would generate that and do that was really important, almost by county and municipality. Yeah. I mean, it's one of those rare occasions. It's not just a general healthcare topic. You really are impacted by local actions. So
absolutely.
Yeah. So another strategic question from people with tactical implications. But have you changed the prioritization of your key audiences as a result of the pandemic, and if so, how? Have people moved up in prioritization? Different segments been introduced that you wouldn't normally prioritize?
I'll jump in on this one. I think when I was talking about how purposeful Hopkins was about its process for determining how to go back to care, we had a similar kind of prioritization matrix about how to, it's not so much prioritizing people, but it's really taking, I mean, there's that part to it, which I was describing, the urgency and the importance of care. But we were also taking a look at prioritization of our own services with a matrix of sorts, considering our own capacity, what kind of revenue might it generate, our readiness, of course, for outpatient and ambulatory and inpatient care. And these things are really important right now because we are being looked to really help to drive volume to begin to recover. So while sometimes, in a broader kind of conversation, yes, we know we're marketing, but we also know what that means in this case, here and now. We're really being asked to try to build the right kind of business. And that really has to be based on, I think, a thoughtful approach about what is the right business for your organization at this moment. Obviously, putting the patient's needs first. Anyway, that's how I think about it.
Following up on that, I would agree. There's some organizations that have taken a 30,000-foot view of what to take to market. It could be we've built a new building, we're attracting talent, whatever. And I think there's much more focused conversations now around what kind of business do we want to bring in? Where are we going to get that business? Can operations handle it? There's the criteria. I mean, I would hope everyone uses some sort of criteria before they make their slate, but people are getting deadly serious about it now, saying, look, we can't deal with that right now or whatever. And then the other aspect of this we have no control over is what's happening in our market in terms of the rate of infection. Last night it was announced Arizona is having a spike. That's new information that's going to cause those health systems to react in a different way than they were 2 weeks ago. So it's a time to be nimble, but a time to be very, very focused on what makes sense for your organization now.
I would say with at Stanford, we went both broad and deep. So we ended up purchasing a lot of paid media just to get the word out right about the ER being open for business. You can return. Right. We had people walking in with the classic direct mail flyers if it was a ticket for admission to the ER. That some people had pent-up demand. And again, I mentioned referring physicians going a little deeper, saying who can help us get the message out? Well, it's those primary care physicians that talk to those patients the most often. And then recent events, it's going to be interesting to see. I brought up in telehealth sort of maybe underserved markets or different markets, whether that be through population health, mental health. I think also minorities that have been impacted. We've had obviously a lot of issues as of late, topics that we've discussed around Black Lives Matter. But in general, prior to that, COVID-19 had a pretty significant impact on certain populations. And I can't talk about really any actions yet, but I think it has definitely raised awareness. When you're at a large school of medicine, students really have a voice around this. I think we're going to see changes there as well, coming out of kind of these two events as to how we addressed underserved markets. I don't know what the outcome exactly is yet, but I just feel there is a sea change happening in the way we do providing care to those markets. So it's going to be interesting to see the results of that. But I did see a question about minorities and underserved markets, and don't have any point-by-point discussion I can share here today, but I'm seeing internally some change really happening, very positive change in our institution.
I would agree on that. And the other thing is, I don't think people really want to defund the police as much as maybe look at what we're spending on policing versus trying to be more preventative. But to your point, Dave, it's so clear-cut, the health disparities with minorities, that perhaps there's an opportunity, if they shift funding around to different areas, a role for healthcare providers to play. Because someone last night was talking about how many millions of kids are in the New York schools, and yet there's a relative handful of social workers and an army of police. Isn't it better to be more preventative? So I think there's going to be some opportunity for us to have a conversation around that, depending on where it goes. It's kind of early, but I think you're right. People are now saying we have to do something. This is so glaringly wrong in terms of how we treat people.
Yes, early in development, late in action.
Mm-hmm.
All right, we've got 4 minutes left. There's more questions, and just so everyone on the phone knows, we've all got the ability to stay for a couple of minutes, or at least most of us have the ability to stay for a couple of minutes overtime. So we'll get back to some of these questions here. The one thing I wanted to ask the panel before we exit for the larger group is, if you had one piece of advice for everyone coming out of this over the next 1 to 3 months of what they need to be focusing on and need to be doing, what would that be? David, you're shaking your head, so I'm jumping to you.
No, it's a very good question. And I think it has been a learning experience for all of us. And I speak for the institution I work with. I think it's retaining that bias for action. Jean talked about how quickly telehealth was brought up and payers made a quick move, and we were able to rally to do that. So, we deal with a lot of crisis. I think this one in particular was one where we really had to rally, have this bias for action, a sense of urgency. And you've heard me mention these legacy effects. I think for us, it's really, we're looking at our organization from a kind of an agility of how quickly we can move, these investment in tools, which will probably also be an investment in skills. We've got to shift our skill set among our staff to be able to deal in these precision marketing tools. So I think I hope it's been a bit of a sea change, at least internally for a marketing department. One, their visibility is higher. Let's not let that go away. Continue to consult rather than react, and be in this positive sort of proactive stance, coming with ideas and insights. We brought forth research and insights. And I hope through the tools we're investing in, we're going to bring even more intelligence to the table. So I think it's, I've been called Pollyanna by my and the folks I share an office with back at Palo Alto, but I do think it's a positive time in this lemons to lemonade coming out of it. And shame on us if we don't really see this as a window of opportunity to
absolutely
be more efficient and play a greater role of contribution to our organizations.
Yeah,
absolutely. If I could add to that, I think the sense of urgency needs to be there, because this is a wonderful opportunity. COVID is a horrible, and we're facing it, and we've got to go on. But I do think if we deal with it with a sense of urgency, that this is the opportunity to build upon the goodwill we have, the tools we have. I think this could be a moment of real creativity for marketers if they're open to it. Anyone who says, when are we going to go back to normal, is not open to it. There is no going back to the way it was, And so I think you need to keep your mind open to the possibilities. And I am Pollyanna as well. So, damn us, Dave.
Well, that
you
makes
look better as Pollyanna than Dave.
I was just going to say, that makes 3 of us. I mean, my family calls me a Pollyanna. I tend to see a rainbow in a puddle. And anyway, I don't know, there's something to it. But I would just add that I think marketers tend to be innovative, right? And be creative and have good ideas. And I do think that most of our organizations are looking for new thinking in this new environment. And so I would agree that I think it's important to step up and offer new ideas. I also do agree with the point that this confluence of, these times, still coping very much with the pandemic, as well as the aftermath and the very challenging issues and conversations that are happening and need to have in the wake of George Floyd's killing. I think our country and our organizations are feeling just incredible angst and anguish. But what is coming from this are really important conversations internally, where we are looking at each other as human beings, not just by title or by role. It's how do you relate? How do you listen? How do you connect? And then as a healthcare provider and system, how do we behave, as hopefully we have been, but how do we behave as leaders and as exemplars in what's best about how to have these, intentional ways of moving forward in a cohesive, strong, leadership kind of way.
Well said.
That's great, everyone. I'm gonna add one more back to the operational efficiency side of things. You guys have talked about the tech. You've talked about some other activities there. I think looking outside of marketing and looking inside of marketing around how we can just be more efficient, improve time to market, reduce process times, and how we look at technology and all of that stuff. There's a real good opportunity right now to find a lot of money, find some savings and all of that, or at a minimum, put yourself in a position to really catapult out of this and do more than you've been able to do in the past by looking at operational efficiency. It's, and again, looking outside of marketing for a lot of that stuff because there's quite a lot out there. So that's, I think, where we need to end the overall discussion, and thank everybody for being here. There's 2 or 3 other questions here that we'll get to. The ones that we can't get to, we'll try and respond over email to those people that ask them. And other than that, I think I'll just say thank you to everybody. We're going to stay on, so if you care to stay on, feel free to. One of the questions, team, is what is your prediction for M&A in the healthcare industry?
Yeah.
Go for it, Suzanne.
Well, I can stay pretty high. I'm not sure I can go very deep on this one, but my sense is there will be quite a bit more. I mean, just take a look at, how many healthcare organizations, hospitals, healthcare providers, systems are not just struggling, but some are going out of business. And that being said, there are still markets, communities, patients, families to be served. And so I think that this was a trend anyway, but I think it's going to accelerate.
Yeah,
I agree with Suzanne.
Yep.
I agree. I'm worried about healthcare. I'm probably more worried about higher ed.
Seriously.
And when you put them together in one system, it's even harder still.
Academic medicine is doomed.
No, you think you have it hard. I have a rising senior, and just like start looking at endowments of higher ed institutions to see if they'll be around. I mean, it's pretty tough.
It is
tough with virtual learning, and maybe we'll learn a lot from that experience too. But I agree with Suzanne. I do think some of the regional and smaller operations, and maybe there's some opportunities for really great or great partnerships ahead. I hope that's the case.
Yeah, there's I mean, this is our world. M&A is pretty much the genesis of 60% of what we do, and every bit of research that I've been in and everything that we're seeing is indicating that that's actually going to be the case. And to your point, higher ed is going to be another area of interesting consolidation, as is oil and gas and energy. Yeah, and healthcare, definitely going to happen. Another question that we've got is, I know volume is critically important to the business model, finances, etc. However, there's a very important value proposition. This gets to outcomes, vulnerable populations, care management, home care, clinical care, etc. Any thoughts on this?
Is the question, how are we going to bring it all together?
Yeah, I was trying to understand.
Yeah, so am I actually. I know the volume is critically important, the business model, finances, etc. However, there's a very important value proposition. Now, I'm not sure that I can actually interpret that, so I'm going to switch to a different one and apologize. If you want to rephrase that question, if you're still on, by all means, go for it. Do your liaisons meet with hospital management to formulate the brand's message?
You broke up a little there, Phil. Could you say that again?
Sorry. Do your liaisons meet with hospital management to formulate the brand's messaging?
Are they referencing physician liaisons, or I wonder, marketing?
Marketing, I'm thinking.
Oh, marketing? Okay.
Yeah. Well, I'll speak for Stanford. There was an integrated strategic plan, and the strategy group, very strong strategy group there, where the ideas aligning more closely the children's clinical system, the School of Medicine, and the adult system, and marketing mainly through the brand. The goal is to bring that to life, right? What does integration look like? And so, and I guess we could touch on the value proposition question earlier. We were working on value propositions related to that. But that was happening at just as COVID hit, and marketing was playing a key role in how you message some of because there's a lot of internal language and of where you're investing in service lines and areas of education and discovery and innovation. Sometimes that's a little difficult to translate to a value to a patient or even to some referring physicians. So that's been a big part of our process. And I think COVID, again, here's Pollyanna. I think it's actually, we're going to play even a greater role moving forward in a lot of those discussions. I mean, think about right now, you're looking at what service lines have the most need, what care did you delay, how are you going to bring that back? And marketing is getting called on to help figure that out. I think it starts with finance and operations, and the next request is marketing. What can we do to recover? So it's from a strategic standpoint, I don't think there's been a better time.
Yeah. So actually, Suzanne, I'm going to interject real quick because the intent of the question was actually physician liaisons.
It was physician liaisons.
Yeah. So
physician liaisons have a unique and cherished role in the sense that referring physicians will tell them things they won't tell anybody else. So they're a great source of information for any organization. So they're key in crafting whatever your message platform is to referring physicians, and it needs to be consistently looked at based on the input they have. And if what you put out isn't ringing true and they bring that back, then you got to respond to that. So I think they're an ongoing part of developing that messaging and the brand and the value proposition for referring physicians.
You're right. It might be the most cost-effective form of research if you have a
absolutely. I'd give up so much more advertising for more physician liaisons.
Yeah.
All right. Well, I think in respect of everyone's time, we should probably wrap it up right there. And I'd like to thank Suzanne and Jean and Dave and also Kevin. I know he's apologized to everybody for the technology issues. It must have been absolutely frustrating for him. I know he had a lot to say. So apologies there. And thank you, everyone. It's been great.
Thank you.
Thank you, everybody.
Stay well.
All right. You too. Bye-bye.
Bye.